You know, it's no secret that good knees are an essential part of a healthy and active lifestyle. There's nothing more debilitating than knee pain, whether it's the result of aging or an injury. But the good news is you do not need to let it slow you down. Joining me from Oxford University in the UK is orthopedic surgeon Mr. Christopher Dodd, who specializes in partial knee replacement surgery. And with me in the studio is Beth Winnebald, who had two partial knee replacement surgeries a few years ago. Good morning, Beth.
Good morning, Olga.
Beth, let me start with you. Let's talk about life before your knee replacement surgery.
Well, you know, I started when I was in my 40s.
The pain.
And that's a time when you should be feeling good and active, and I could not be active to the point where it kept me from participating in family vacations or traveling with my husband.
Frustrating.
Frustrating. I would even started having pain when I slept in my knees.
Oh
so I'm trying to sleep and it wakes you up, or you can't go to sleep because the pain is agonizing. So it's a very difficult thing.
Good morning, Mr. Dodd. Thank you so much for joining us this morning.
It's very good to be here, Olga.
People like Beth and so many people out there who suffer from this knee pain, what causes this?
When the lining of the joint between the thigh bone, the femur, and the tibia, the leg bone, begins to wear out, then bone articulates on bone, and that is very, very painful. Now, initially the pain occurs only after a lot of activity, but as the arthritis progresses, the pain can be increasing and will limit one's ability to get in and out of a chair, to go up and down stairs. Eventually, it may affect the patient at night. Increasing evidence suggests that genetics plays a big part in arthritis. Previous trauma and certainly being overweight are major causative factors. If you have a bit of malalignment, such as a knocked knee or a bow-legged, then that may cause arthritis.
And Mr. Dodd, let's talk about the difference between a partial and total knee replacement. How do you know whether or not you need to have this surgery?
Let's say an apple represents the knee joint. In a total knee, the entire surface is removed, whereas with a partial knee, about 75% of the surfaces are retained. And this allows for a much quicker recovery and a much more normal feeling knee. Studies have shown that patients walk for longer and get back to higher levels of activity and sports after a partial compared to a total. But ultimately, you should ask your doctor about whether you're suitable, and you should discuss the issues involved with him.
And Beth, you discussed this with your doctor, as my father did too.
Yes, I did. He examined me, he x-rayed me, and he said, you are a candidate for the Oxford partial knee. And we decided that was the best thing to do.
And how was the surgery recovery?
The surgery was simple. It
Really?
Truly was. The doctor made it so easy. Then coming out of surgery, I was free of pain. I stayed in one night in the hospital. They had me up and walking within hours. And within a couple days, I was walking without any aid. So it was a very, very easy thing for me to do, particularly considering all the pain I had been in.
Which is great to know, because a lot of people are fearful of having this surgery,
Yes.
thinking that the recovery, and it's a lot easier than one thinks. Mr. Dodd, let's talk also about when it's time to undergo surgery and what happens and what are the effects of waiting too long?
This should be discussed with your physician before coming to a decision. But primarily, increasing pain that begins to limit your sleep, your ability to walk around, and which limits your daily activities, that's the time to consider surgical intervention. The most predictable outcome of surgery is pain relief, thereby allowing for happy patients.
And speaking of quality of life, Beth?
It really is a new beginning for my life. I've been able to travel and
You're
walk on
doing
the
things.
beach, and I'm doing things, and I have time with my family, and I can stand in the kitchen and cook with my family. Life-changing for me.
What about the pain? No more?
The pain is gone. It is gone. I'm just feel like a normal person now.
So for anyone out there who maybe is going through what you went through, you would tell them to?
I would say do it. And I'm thankful for the good doctors who have faithfully worked, and with others too, to make sure that we have something like this that people can go to and turn to.
Fabulous news. Thank you so much for your time
Thank
and for
you,
telling
Olga.
us your story.
Thank you.
And thank you, Mr. Dodd, for all the great information. Truly appreciate your time.
Thanks for having me, Olga.
And to find out more about the Oxford partial knee from Zimmer Biomet, go to oxfordknee.com, or you can always go to our website, and that's thebalancingAct.com.